Hey guys, and welcome back to my channel. So last week we focused on the top 30 questions that you could be asked during your nursing interview. So today we're going to be covering on the questions that you need to ask the interview panel. And the reason for this is, as much as we're all desperate or so excited that you want to get into this nursing university or this nursing college or whatever, you also need to determine if the university or the school is a great fit for you. You also need to find out other information such as how they structure their program, the amount of hours that you're required to cover, ratio between your lecturers and the time that you're going to be spending in a clinical placement, what is their graduation rate look like, and things like that. You do not want to set yourself up in a university or college that is not going to help you with your end goal of graduating as a competent nurse and things like that. And also the other thing that I would also suggest is that you do interviews or sort of like an informal Q&A with someone within that university or that college that you want to go into. Trust me, having the hands-on or getting the information from the horse's mouth, as they say, about the university and the college and people's experience, it will really help you to understand what you're getting yourself into. And the reason why I'm telling you this is something that I learned the hard way. When you get into the university and then you discover how other universities are doing things and you're like, oh, okay, that's a little better than what's happening at our university and things like that. A good example that I can give you is our university didn't have the block system that CPUT has, where the block system is for 3 weeks or maybe a month, you're in a clinical setup, and then for another 3 weeks, you are now doing just theory. Because one day you're in clinicals, the next day you must now be juggling class schedules and things like that. Whereas at CPUT, you could just focus on being in clinical placement. You learn things quicker. You are there on a specific shift. You have the continuity of. Whereas with us UW students, we would come one day a week, and then we have to relearn everything the following week and things like that. So if I had investigated that in the beginning, I would have better understood what I was getting myself into, and maybe I would have chosen differently. Who knows? But I never applied for CPUT because I didn't know that a nursing program. But yeah. And anyway, also you need to know from people's experience what they think about this nursing program. What are the challenges that they're having? What are the good things about the program that they're experiencing? What are the things that this university offers and another one doesn't? And this will help you to better choose which university and which program to get yourself into. So without rambling any further, then let us get into the questions that you need to ask. I'm going to be giving you the question, also the rationale of why you need to ask these questions, and then it's going to be like a long list going forward, so you can just pause and then take down a few questions that you want. But I also put it down in the description box so that you can keep a record for yourself, and you can just pick a few questions for the next time that you go for your nursing interview. So question number 1, what makes this nursing program unique compared to others? It goes back to the introduction that I did with this video. What am I getting from this university that another university is not going to offer me? So the reason why you ask this question is to show the panel that you actually invested in learning or understanding what the university is going to offer, and also that you are taking an initiative and understanding which nursing program to choose between. It helps them to see that, one, you are really interested in nursing, and also that you actually care about what program you're going to be studying, and it shows them that you have initiative. So at the same time that it's showing them the type of personality that you have, and it's counting towards brownie points towards yourself, but it's also for you to understand what you're getting yourself into. Second question is, what support services are available for students struggling academically? You need to know what support your university is going to offer you, and this is a good question to ask the panel and also students that are within this university, because the university will tell you all these things that they're able to offer, and you're like, oh, okay, cool, thank you so much for letting me know that. But also you need to see if it's going to if it's translating well to the students that are within the university. Third question is, what clinical opportunities are like? Like I said, within the comparison that I gave with CPUT and UWC, you need to know what clinical opportunities they're going to offer you. Are you going to be specifically just in a government setup? Are you going to have a combination of both government and private? And also, what type of disciplines or specialities are you going to be going into? Is it just your general med surg to get to going to theater, ER, etc., etc.? You need to know which rotations you're going to go through, because if you're someone who is studying nursing and maybe you want to get into oncology or the ER, but they never take you to the ER, what's the point of spending all this time in the nursing program if they're not going to expose you to such things? So you need to know what this university or the nursing program is going to offer you. The fourth question is, how do students get assigned to clinical sites, and can we choose our own specialties? This question helps you to understand which nursing specialties you're going to be going into. It also helps you to understand how the rotation system is going to work. Do they do it on a monthly basis, semester basis? Is it a few weeks here and then you move on? And it also helps you to understand how you're going to be moving between these different specialties, whether they're going to give you a choice or they say these are the specialties that you have to go through and you just get rotated according to their schedule. And also you need to also understand how you're going to go to those facilities. So it's also important that you sort of find out what sort of facilities that they interact with. Fourth question is, what's the student to instructor ratio during clinicals? And this is very important, because if you know that the clinical facilitator and the student ratio is very high, it also means that you're going to be having very little time with your clinical facilitator, and you need to be aware of that. As a result, this means that you need to lean more on the students that you're with and also with the nurses that are in the hospital, because if you know that your clinical supervisor is only coming once a month to see you, you need to make sure that you're learning as much as possible within your clinical rotation, and you need to use the nurses in the ward to help you to learn these things. And also that means you also need to put in extra initiative on learning these skills, because if your facilitator has more students than they're capable to handle, or just usually more students in general, it means they're going to see you less, and it's important for you to keep that in mind. Next question that you need to ask is there any special certifications or training that you receive beyond the standard curriculum? Yes, your nursing program is supposed to give you your degree, your diploma, your certificate, etc. But you need to know if there's any extra certifications that are going to help you as a new graduate. For example, your first aid, your BLS, your ACLS, wound care certifications and things like that. If you know those things in advance, if there's any extra certifications that you feel you're going to need for whatever specialization that you're going to specialize in or get into after you graduate, then you know in advance, okay, these are the steps or these are the funds that I need to put aside to be able to get those certifications. In most cases, all universities and colleges should provide you with BLS training. But if you feel you want to be a first aider level 1, 2, and 3 and you want to go higher, then you know that those are things that you're going to have to cover at your own expense. So if you know that in advance, it helps you to prepare better, and you also know what the university is offering you. Next question, which is very important to ask the lecturers or the interview panel, but also the students that are within this college or university, is what's the biggest challenge nursing students face in this program? If their biggest challenge is students graduating on their time, then you need to question, okay, is it because there's too much workload, they don't know how to teach, hence less people are graduating and that sort of thing. If their struggles is students struggle in the clinical facility space, they need to understand, okay, is it because there's no clinical facilitators to ask them, or is there other reasons? If they can be honest with the type of difficulties or obstacles that their students face, it helps you to be able to understand that they are cognizant of what's happening, and we hope that they're actually putting in measures to help students with those obstacles. And also, if you know what obstacles people are facing, you can better counteract that. Like if you know that students struggle with finishing their clinical hours, then you know that you need to spend more time to fit your schedule to the clinical hours to make sure that you finish, because you don't want to get there and be caught on surprise. So if you know in advance, it's better to prepare yourself. Another good question to ask is, what level of independence do students have during clinicals? If they're going to tell you that majority of the time you're going to be spending it with your clinical facilitator, it means that you're going to have very little hands-on experience of what's happening in the hospital. And why I say that is, if majority of the time that you're in a clinical setup, you are spending it with your clinical facilitator, it means that whatever experience that you're getting in that ward, it is in a controlled environment, and you're actually not getting the full experience of what happens on the floor in that hospital. You need to be in the hospital on your own for you to be able to learn what to do in a certain situation. And also you just learn better if you're doing things by yourself, by practice. Because if your clinical facilitator is there majority of the time, it means that most of the things that you're doing, it's a guided practice. It means your facilitator is doing it and they are watching. And as a result, it doesn't allow you to get the full experience. Also, you need to learn how to interact with the multidisciplinary team, whether that's the nurses, the OTs, the physios, the doctors. You need to be able to interact with those things on your own. And it helps you to build confidence in being in a clinical facility. So as a result, if the clinical facilitator is there a lot, you need to question what exactly they are teaching you in that clinical facility. Because your clinical facilities are meant to show you, and they let you go off into the world. Trust me, that's the best way to learn. We also felt very frightened when you're like, oh my gosh, I'm here by myself for 12 hours. What do I do? But that's the best way that you're going to learn. This is a really exciting question. How early in the program do students begin clinical rotations? The quicker you get into the facility, the easier it is going to be for you to learn about nursing school. Because whatever you're learning in class, it's going to translate back into clinical facility and vice versa. So the quicker you get into the clinical facility, the quicker the theory is going to make sense, because you're going to be like, oh, we're learning about hygiene in class. Okay, now I'm washing a patient. All right, now it's making sense. The later you go in, the harder it is going to be for you to catch up, because now you have fallen behind where your theory and what's happening in the hospital is not matching up. I think as after 2 weeks we're in the clinical placement, and I love that. Like, all we knew was bed making, but we were pros at bed making, and it allowed us able to see what's happening. So you need to gauge on how quickly they're going to get you into that clinical facility. Next question is, how do instructors help students manage stress and workload? This shows that you are aware that nursing school is very demanding, but it also is for you to understand what sort of support the program is going to offer you. If they're just going to say, it's up to you, you need to figure it out, it means that there's very little support that these clinical facilitators, these lecturers in this nursing program and nursing college is going to offer you. And you are going to need support. Nursing school is very demanding, it is very stressful, and you need someone to be able to guide you along the way if things get tough, and you need to know what sort of help they're going to be offering you. Next question that I wish I had delved more into when I was doing my interviews is, are there networking events with alumni or local healthcare employers? A lot of students are struggling after they graduate to find work because of lack of experience. And the reason why this question is important is you need to know if your nursing university or your college is going to assist you in finding a job. Because in most cases, nursing universities and colleges are literally making graduates and just throwing you out. Whatever happens after that, you're on your own and you have to figure out. And that is very bad, because we have a lot of nurses that are now becoming unemployed because you don't have experience. And you tell the job market, okay, give me a job so that I gain experience. No, you need experience first. And it doesn't make sense. And all the experience that we gain as a student, it gets discounted because you're like, oh, you were a student. But if you get to meet with alumni, you get to understand what the experience was, what they did to remedy that situation. And also, if you get to meet with employers ahead of time, especially if it's a facility where you're going to be doing your ComServe in, or just for them to be aware of who you are. And if you get to build that relationship as your years build up, as you're finishing your program, by the time you graduate, they are more willing to train you up to become a professional nurse or a permanent staff in that place. But in most cases, they just want us to figure it out on our own. So that is a very important question that we need to be asking our nursing colleges and universities of how are they preparing us for after we leave university. I know the current present moment when you are studying is the most important, but we also have to know what's going to happen after we graduate. How are they assisting you? And in conjunction to this, you also need to ask what percentage of graduates find jobs within 6 months of graduating. And this will help you to see if the university is actually creating competent nurses that are able to find work. Because if not, that nursing program is causing problems for you. And the last question that I would like you to ask is there anything else you think I should know before making my decision? This will help you to let them know that you're actually taking this serious, and also for them to make you aware of anything that they have experienced, things that they have seen from other nursing colleges that made their experience really bad or really good. And if they can offer you some advice regarding that, that will help you to be able to make a better decision about which nursing program you're going to get yourself into. And also it's going to help you in the trajectory of your career. So this is only a few questions that I've touched on the long list of questions that I have that you can ask the interview panel of what to expect when you get into this program. So you can find all the questions down below in the description box. But I wish you guys well with your nursing interviews. There is 3 more videos coming in this series of, preparing for nursing interviews and things like that. So you can find last week's video over here, and you can also check out this series over there. Or if you're done with this series, you can also check out the series that I'm doing over here about the nursing specialties that you can get into. Until next week, Friday, 12 a.m. South African time, have an awesome one. Bye, guys.